all doing good. Before we begin, I would like to welcome our principal, Ms. Daisy Ryan. A warm welcome to all the parents. This session will immensely help you to understand the significance of dental development of your children and the facts related to it. For that, I would like to introduce and welcome you to Dr. Nisha Bali, Master Clinician at Dental Plastics. She has an immense clinical experience of 20 years in the field of dentistry. School dental health programs are a major part of her annual plan. She is married to an Army dental officer, and they both are doing conscious parenting for their own children. This session will be based on her own clinical experiences as a dentist and as a co-parent. So before we start, I will request all the parents, if you have any questions during the session, you can note it down. And end of the session, Dr. Nisha will help you with all the answers. Yeah? Over to you, Dr. Nisha.
Thank you so much, Shavi, and thank you, ma'am, for giving me the opportunity. Today, as we know, we are basically discussing the relationship between food, speech, and the dental development in children and adults. Yes, ma'am? So, we are basically going to focus on packaged healthy food and how modern day lifestyle and habits affects the growth and development in children. Now, why are we even discussing this? Because I feel that food industry has broken our trust. Why is that so? Because constantly the cases are on rise. Then we are doing a lot of root canal treatments for children. We are doing crowns for children. So the work is only increasing, right? And that is why I feel that we are having more packaged healthy food. Okay. Also, at the same time, parallelly what we are seeing is that a lot of children are complaining of stomach pain. As soon as they eat anything, they complain of stomach pain. They have mouth ulcers. They have ulcers on their tongue. They are not enjoying eating fruits and vegetables. Moment you give them fruit and vegetables, they refuse it. Because whenever they had it in the past, that used to cause increase in bloating, increase in stomach pain, and side by side what we are also seeing is increase in temper tantrum. Also, some children are showing less physical activity, and there are some children who are showing hyperactivity. So there are parents who are dealing both the cases at home, and also there is increase in aggression. Plus, there is some children have lack of attention. All these things are also linked to consuming more of packaged healthy food. Junk food we all know, right? We all know about junk food, and the name itself says it is junk. But today we are discussing about packaged healthy food, packaged healthy supplements, and also the way we eat our food nowadays and the speech, how it affects, right? I mentioned earlier were more in children. Now I am going to talk about what we are seeing in teenagers and adults. In teenagers and adults, what we are seeing is increase in obesity, increase in acne. So teenage acne and adult acne. Then we are seeing increase in bone fractures. More of male children, a male child is having fractures, whereas teenage girls are having more PCOD issues. So fractures are common in old age, of course. Those who are having malnourishment and all those things, but if you compare teenage boys, they are having more fractures, and teenage girls are having PCOD. Every other girl is today diagnosed of PCOD. Women in their 20s and late 30s are also being diagnosed of PCOD, right? Then prostate related issues like cancers also, which are on high rise. Thyroid related problems. A lot of women, when they are pregnant or after their deliveries today, are diagnosed of hypothyroidism. Hyperthyroidism is also on rise, but women especially during pregnancy or delivery are diagnosed of hypothyroid. Then complicated pregnancies and assisted deliveries are also on rise, right? So Plus one more thing which I just forgot is teenage diabetes. Teenagers are today diagnosed of diabetes and pre-diabetes. You know that India is becoming the hub where more and more people are having diabetes. What is the main reason? The reason is packaged healthy food. What is the problem? That is what we are going to discuss. Now, let us understand this one by one. We are having a fast-paced life. Added to that is unnecessary pressure of social media and our social lifestyle. Right? Food industry has greatly benefited from this. Advertisements, attractive packaging, and marketing of products as healthy has created a lot of problems. What is the main problem? I will just tell you there are few chemicals in these packaged food items which is there on everything. You pick up multivitamin, multi-mineral supplements for children. You pick up protein powders, formula feeds which is given to the babies. Then infant food, first food, ketchups, sauces like pizza and pasta sauce, then lot of dressings, salad dressings, toothpaste, mayonnaise. So all these things have few things in common, that is flavoring agents, emulsifiers like carrageenan, lecithin, preservatives. If you see, there is no detail about preservatives. It is written class 2 preservatives, class 3 preservatives. When you go to find out what are these preservatives, these are sulfate based preservatives. Okay, sulfate basically chelates with calcium in the body. So in spite of person taking good dietary intake of calcium, still shows up as low, the bone shows low density of calcium, right? So then we are put on the supplements. Then the supplements again have these sulfates. The cheese, the processed cheese, the pizza cheese or the processed steamed cheese or the cubes, they also have these preservatives, right? Then artificial sweeteners like xylitol, sucralose, etc. are present in all these items. Coloring agents. Hydrogenated vegetable oil. Hydrogenated vegetable oil is present in formula feed, it is present in Nutella, it is present in biscuits, it is present in even chocolates like Hershey's chocolates, M&M's, it is present in all international brands, it is present in all local brands. High fructose corn syrup or corn syrup. So these are the common ingredients which is present in everything, whether it is junk food, it is packaged healthy food, in supplements, in milk powders, unfortunately in toothpaste also. Right? So these things are the problem. The main ingredient may not be the problem. Ragi may not be the problem. Even maida may not be the problem. But these things are the problem. So, we consume these things. It creates gut problem. Today, in many fields, we have found that the gut has a connection to everything. So, even to dental health, it is related. It causes gut problems and indigestion, bloating, and the assimilation of food into the bloodstream is affected. So, you might feel that we have eaten fruit which is rich in vitamin C. It is the fruit which is rich in iron, but still, we are iron deficient. We have low hemoglobin because the assimilation has not happened. The chemicals in the food in these forms have affected the absorption of the food into our bloodstream. Okay, so then what happens? So in spite of eating, the body remains undernourished, and also these increases the craving for these food items because these food items have additives, and when the absorption is low, body is feeling low in energy, the craving for sugar food increases. When the craving for sugar food increases, we consume sugar food, and that is what causes cavities. So there is it's not like we are not known of this fact. We all know it that sugary food will cause dental cavities. It will cause dental problems. Now, so because of these craving and because the gut has changed, there is severe bloating and the child is unable to enjoy fruits and vegetables. Some of the adults also they say हम fruit खाने से हमें bloating हो जाता है या हमें stomach में pain हो जाता है, right? So we are not able to have it. How do we overcome this? What do we do? First thing, let's start from the basics. When we have conceived the child, a mother during their conception period should eat a balanced meal, home cooked balanced meal. Do not consume any packaged food, consume only home cooked food and include everything in your diet so that the fetus inside gets the taste of it. That is the very first step, that your child will start eating everything because they already are getting that kind of flavor when the fetus is in your body. So during pregnancy and during breastfeeding, expectant mother should eat well balanced, homemade, healthy food and should include all fruits and vegetables in her diet. Now there is a problem that when the child is born, today because of the social media pressure and our own outlook towards the body, we want to lose weight. There is an urge to lose the pregnancy weight as soon as we deliver, right? That also creates problem because most of the women go on crash dieting and stop consuming desi ghee. They stop consuming good carbohydrates like rice, wheat and jaggery because they want to lose their weight, but they forget that they are feeding a baby. They are supposed to do breastfeeding. So when they do this, what happens? Their thyroid glands get affected. So the women who do this, their thyroid gland gets affected and they develop hypothyroidism. So please do not do this. Have balanced meal all throughout your pregnancy and when you are breastfeeding. Breastfeeding is very important. I will come to that. So breastfeeding also you must eat all fruits and vegetables so that the child will accept that taste when you will start giving your child fruits and vegetables when the baby will become 6 months old. Okay. Now there is also one more thing which we are commonly seeing, that most of the women are working now. They have maternity leave for 6 months. So under some pressure or because of inexperience, they feel that in 6 months we have to join back our work. So I don't want to do breastfeeding. I will express the breastfeed and give my child that expressed milk in the bottle. So you all by now knows that breastfeeding is very important. I don't want to stress on that fact, but I will come to the point why breastfeeding is important. Okay, you are giving the breastfeed in the bottle, that is not right. You have to do breastfeeding. I will come to that point. So do not express the milk, feed them directly because there is a difference in suckling and there is a difference in sucking. Breastfeeding is an art of suckling. The baby optimally uses the muscles, the jaw muscles, the lips, the tongue and that is how they suckle the breast milk and that is what allows the optimum growth of the jaws. You will see when you compare a breastfed baby with a bottle-fed baby, the breastfed baby will have good chubby cheeks. Whereas the bottle-fed baby will not have chubby cheeks, whether it is a breastfeed in the bottle. Okay, in sucking, the bottle feeding is sucking. Sucking is an effortless way. The baby doesn't have to put in any effort. So the muscles, the jaws, the tongue, they are not optimally used. So they remain small in size. The classical thing which you will observe in a bottle fed babies, they will have small jaws, they will have closed dentition. What is closed dentition? When you notice their teeth, when they have erupted, there are no gaps. So, you have been, seeing children from so long, you must also have noticed that there are some children who have teeth which do not have gaps. But there are some children who have gaps. Like if you notice Agrima, Amog and Nirvi, they have gaps in their teeth. That is called open dentition. And we want open dentition. The nature has designed it like that. But nowadays, in milk teeth, we are seeing closed dentition more commonly, rather we are seeing crowding also. And this is classical thing which you see in bottle fed babies. And they don't have chubby teeth also. So if you want your baby to develop good features, good facial features, prominent jaw bones, prominent cheekbones, you should breastfeed your child and not bottle feed your child. Don't be under the pressure that 6 months later kya hoga. Wait for that 6 months to come, then you introduce the food and let the child get the nourishment from the food. But do not deprive the child of this breastfeeding act. Okay. So now the next problem is that some women physiologically may not produce enough breast milk, or due to some medical reasons they are not able to breastfeed. Maybe the child is premature born and is in NICU and all sorts of problems. So in that case, the baby is given bottle feed. Now what do we normally give now? I have seen, I have 4 children, but first 2 babies were thoroughly breastfed. There was no formula feed given to them, and the last 2 were twins. They were, given formula feed. So now when that stage came, we asked the pediatrician what to give. We were also guided, give formula feed. There were so many brands, and the brand whichever the pediatrician recommended, we gave them. We didn't have much of an issue, but what I have realized is that we were asked not to give cow's milk. We say, it is, when you also Google search or even pediatrician, they will recommend that do not give cow's milk to the child till 1 year of age. Because the Western research has shown that the cow milk is not correct for the baby. But we have forgotten that Indian, ancient system, and even when I was growing up, I was given cow's milk, and I did not get cavities, I did not get any problem with it, because जो हमारा Ayurvedic system है, that is specifying to A2 cow milk, desi cow milk, and not to A1 cow milk. A1 cow milk cows are basically imported from the West. The Western world, they don't have A2 cows. A2 cows are native Indian breeds. And A2 cow milk is safe for the babies from 0 to 1 year. So without hesitation, you can give A2 cow's milk provided you have to verify your source. So verify your source and see from where you are getting your dairy produce. But A2 cow milk can be safely given to babies from 0 to 1. But do not add sugar and do not put any other additives. Alright. So if the mother is not able to produce breastfeed, you can safely give A2 cow's milk and do not give A1 cow milk. Avoid formula feed as much as possible. Use formula feed only in those cases when you are traveling. So when you are going on a vacation for 3-4 days or maybe 10 days, that time you can carry the formula feed. But on day-to-day basis, please avoid formula feed. Especially stop formula feed when the child has become 8 months to 9 months. When the baby starts sitting upright and has started accepting the sipper cups or the glasses directly, you can stop the formula feed. Do not continue formula feed as much as possible. I told you the problem with formula feed is again the presence of additives. We are seeing high rise in nursing bottle caries. Nursing bottle caries is the reality of today. Children as young as 2 years of age are having rampant cavities, and this is mainly seen in those children who are formula fed at night in the bottle. Such a thing is not seen generally with children who are breastfed at night or are given cow's milk without addition of sugar in the bottle. But compared to formula feeding, invariably all the children come to the dentist for the treatment. So when we have to treat a child with rampant cavities at the age of 2, most commonly it is done under general anesthesia. So if you ask the hospitals, any major hospitals, there are at least 3 to 4 cases in each hospital treating dental cavities under general anesthesia. This is the reality. Because it is very difficult to treat 2-year-old child under local anesthesia on the dental chair. And multiple visits are required. So in that case, general anesthesia is preferred and the pediatric dentist does this treatment in one go under general anesthesia. So do we want that? We don't want that. We want a healthy patient base. We want to prevent the cavities right from the beginning. Right? So understood. Then learn to swallow. Switch over to the sippy cups or the direct glasses. None of my children have taken sippy cups. They have all had milk and other things directly from the glass. When the first teeth starts coming, of course we start feeding the child with khichdi and mashed food. So mashed food is acceptable till the time child is 1 year old. Because it takes time for the molars to erupt. As soon as the first molar has erupted, we should start switching the food from mashed food to solids. We should introduce whole fruits. The child should eat a whole apple every day. This is a too big a size of an apple. Of course, a small child will not be able to finish it. You can give them, a small bite or a half apple or something like that, depending on the age. So between 2 to 6 years of age, when the child has milk teeth, please start giving them whole fruit. Don't cut into pieces. Give them whole banana. Don't cut banana into pieces and give them with fork. So I am now talking about two things. One is that how they are supposed to eat and what they are supposed to eat. Today, nowadays, we are in too much of a hurry to teach table manners. We want to cut fruits into pieces and we want the child to have it with the fork. It's a good thing. We should gradually train the children, but don't be in a hurry. Let them eat like how nature wants us to eat. Nature wants us to pluck the fruit, wash it and eat it. And that is how we should allow our children also to learn it. Introduce as many fruits as possible. Pears, bananas, papayas and veggies like carrots, cucumber, and try to give them in big pieces so that they are biting into it. And by 2 to 6 years they can start even eating corn cob, bhutta kha sakte hain. Don't give them only sweet corn in a cup. Okay, give them corn bhoon kar ya fir usko boil karke, but give them one big piece so that they are biting into it. We want open dentition to develop and not closed dentition. Also, we have to start introducing yoga practices like pranayam. Pranayam, it allows the maxilla to grow. Once the maxilla grows, the nasal cavity also grows properly and your child will have less congestion. आजकल हमारे सिटी के बच्चे बहुत ज़्यादा प्रोन हो गए एस्थमा को लेकर, ब्रोंकाइटिस को लेकर. So even it will help that once the maxilla grows properly, they will have less congestion. So introduce pranayam. Once the maxilla grows, the mandible will also grow. So practices like giving whole fruits and vegetables, pranayam is very important. The third point is what you are talking, how the speech. Please, the first language should be your native mother tongue. It can be Marathi, it can be Hindi, Kannada, Sanskrit, Tamil, any language, any regional language you belong to. Hindi, Punjabi. So ये सारी languages जो है बच्चों की पहली language होनी चाहिए. The first language should be native mother tongue. I just Give you an example. I'll give you an example. My mother tongue is Hindi. So हिंदी के जो अक्षर हैं जैसे अ, आ, ई, उ, ए, पूरा जॉ का जो ग्रोथ है वो हो रहा है, जॉ का मूवमेंट हो रहा है. Now I'm grown adult, my jaw structure will not change. Like the children who are as young as 1 year, when they are starting to speak and when they start speaking in regional languages, the jaw moves. When we compare it with English, letters like A, B, C, D, there is not much of the movement. So please allow the children to talk in native mother tongue, and once they have learned the native mother tongue, they will pick up as many languages as you want during their lifetime. Morning में 2 years back when our twins were growing, we changed over from saying good morning to suprabhatam. Good morning. How much is the movement? And when we say suprabhatam, there is an expression, there is a lot of movement of the jaws and tongue, right? And this again helps in the optimal growth of the jaws. Okay? Increase our, packaged food. It is so difficult. Everybody is working, children are going to school, mother is working, father is working, grandparents are involved in their social activity. So that way, to ease out, we have increased our packaged food. What we have to do is that please understand that kitchen is for everyone. Involve all the members in the house in the kitchen, even your children. How can you do it? First thing is that let the children connect with the food and the ingredients. Introduce spices in your food. Do not serve them bland food. We have lot of variety of spices. They should know the name of those spices in the mother tongue also. So let the children have a connect with the food in regional language. So use the the name of the food should be taken in your mother tongue, like khichdi, dalia, halwa, chila, dahi, laddu, छाछ, पापड़, etc. ये सब words बच्चों को समझ आने चाहिए. Not only pancakes, not pastas, and not yogurt. बिकॉज जब हम योगर्ट बोलते हैं तो उनके पास सिर्फ कनेक्ट कहाँ जाता है जो सुपरमार्केट में हम योगर्ट का डब्बा देखते हैं, राइट? दे शुड हैव अ कनेक्ट विद दही. सो इन्वॉल्व देम इन मेकिंग दही एट होम. इट इज सो सिंपल, इट्स सो एक्साइटिंग फॉर देम. सो लेट देम कम टू द किचन, लेट देम हेल्प यू आउट, लेट देम गेट द फ्लेवर ऑफ ऑल द स्पाइसेस. उनको इलायची का फ्लेवर पता होना चाहिए. आस्क देम टू स्मेल लौंग का कैसी खुशबू होती है. सो वन बाय वन, डे आफ्टर डे, लेट देम स्मेल दीज फूड आइटम्स, let them know the name of these food items, let them identify these food items in their food so that they are able to tell you कि मुझे ये अच्छा नहीं लग रहा. Instead of saying कि मुझे दाल नहीं खाना, instead of saying कि मुझे कढ़ी नहीं खाना. Okay, so start having a connect with them. I am not saying give them spicy food. I don't mean to say that. I am just saying give them flavorful food which is homemade at home. Okay, so involve your husband, involve your in-laws, involve your parents, and you yourself be in the kitchen and do maximum cooking as much as you can do. So children can school में तो सिखाए हैं, let them peel the butter for you, and when you are making गाजर का हलवा, let them see you peeling that carrot and grate it. See, when we do these activities, we can easily skip the gym, right? The time which we are taking out to go to the gym, we can easily skip because kitchen itself involves a lot of work. And when we are doing all these things, we feel very nice. You will start losing weight, and you will be able to sustain that weight which you have lost. The weight will not come back, right? So start doing this, and like the tradition and custom of gifting homemade jams, homemade chutneys. So these are the things which my patients have got it for me. So this is a gooseberry jam and this is a grape jam. So this they have made it at home and they have got it for me, and that's what excited me to this time make my own strawberry jam and pineapple jam. And children also like it, when they are seeing that, I have bought so many strawberries, I am washing them, involve them in this process. You will have a better bonding and they will have a better connect with the food. You will struggle less, right? So, do these simple things. Then, I'll come to the brushing technique now. Since we are talking to the parents who are basically, parent of children between 2 to 6. ब्रशिंग करना बड़ा मुश्किल होता है बच्चों का. What I use for my children is a power toothbrush. Okay, so it comes with you can use different tips. You can have the same base. Powered brush. What is the advantage of powered brush? It is a small round head. Okay, so small round head, and when you put it on the tooth. So it is only cleaning the tooth. So when we do manual brushing, what happens? बच्चों के jaw बहुत छोटे size के होते हैं, and when you are doing it, it is hurting them. It is hurting their sulcus, or it is hurting their tongue inside, and then they don't cooperate, and then we give up. This is quick, effective, and also it doesn't hurt them. So imagine these are the teeth. So you put it on and quickly clean each of their teeth. Alright. So this is what I use for my 3 kids. I have got 3 different tips for them. I keep replacing the tip and I quickly clean their brush. For the paste, what I found is that lot of paste, any brand, whether it is Pigeon, it is Chico, it is any good brand, you name it, has again emulsifiers, preservatives and artificial sweeteners. And most of the children, because of the flavor they like, they tend to swallow it. We have to prevent that, because that's the main reason why your child is having stomach pain and child is having bloating, child is not enjoying the fruits and vegetables. I have already discussed this, but again, remember your paste has this. Can we eliminate the paste? I am trying to find out what is the solution to it, but as of now, what I can just say, use minimum amount of toothpaste, only green pea size of toothpaste, introduce only when your child has learned to spit it out. So, if your child till 3 years or 4 years has not learned to spit out, do not use toothpaste. Use only toothbrush. Brush after breakfast and brush after dinner. After meal, brushing is very important. Okay? Toothpaste should be included in regular care only when the child has learned to spit it out. Child should not swallow it. And even that time also, the size of the toothpaste which you put on the bristle is just minimal pea size. Alright, and then after that brushing, make sure the child is rinsing the mouth. There should not be any residue of the toothpaste which is sticking on the tongue or anywhere in the mouth, because ultimately it is going to go to the gut and then the problems will begin. I have had children who had tongue ulcers. We stopped the paste for them and they are feeling much better. The ulcer has not come back. So it is not really related to the allergy. It is the long-term problem which is caused because of the emulsifiers going inside the gut. Okay, so brushing twice a day should be started as soon as the tooth erupts in the mouth. Do not use toothpaste till the time child doesn't know, spitting out. Don't be in a hurry to introduce any toothpaste, whether it is written preservative free, paraben free or fluoride free, whatever is written on that paste, do not use it. Herbal tooth powders, you can definitely try. Herbal tooth powders, mix it with coconut oil, and one can do it with the finger also, and one can do it with the soft toothbrush also. Tooth powders are not having any artificial sweeteners. They are mainly salty in their nature. So that is still safe, but one has to see more in depth how to do it. Tongue cleaners, copper-based tongue cleaners can be used, right? And coming back to the food again, not to eat. We have to stop ultra-processed food. The worst of it is bread and biscuits. Great amount of effort is required by you all to find a good source of bread. Preferably have sourdough bread, but only once in a week. Only once in a week, not more than that. Breads are basically a simple carbohydrate. The digestion of it begins in the mouth. So bread or biscuits, whatever it is, the digestion of it starts in the mouth, and the byproduct of it is acid, and that acid will cause weakening of the calcium in the tooth, and the decay would start. So ultra processed food like breads and biscuits should be immediately stopped. You can buy your bread from a local bakery who is making a sourdough bread, whether it is a wheat bread or whatever bread it is, but consume it only once in a week. You can safely give chapati with homemade jam, chapati with jaggery or gur, with desi ghee or butter, homemade butter, not processed butter. You can give it to the child, and your own snacks at home. Do not buy any snacks, whether it is from any company who is who is claiming that it doesn't have any preservatives and it is healthy to eat. Do not get from them. So make it at home. What are the good snacks you can give your children? Makhanas, ghee roast makhana, matri, mathi, and dry fruits. Then you can give bhuna hua chana, peanuts, and नान खटाई, घर की बनी हुई नान खटाई या अच्छे से सोर्स से आपने मंगवाई हुई नान खटाई, बट प्लीज अवॉइड कुकीज एंड प्लीज अवॉइड बिस्किट्स. देन भाकरवाड़ी आप दे सकते हैं, चपाती विद गुड़, दैट इज ऑल्सो अ वेरी फुलफिलिंग स्नैक्स. यू कैन गिव. एप्पल के ऊपर पीनट बटर लगा के दे सकते हैं, but again peanut butter should be made at home or get it from the source who is making only out of peanuts, not adding any other things. We have to avoid chocolates, we know it, but sometimes we have chocolate craving. What do we do? So at home, make your chocolate custard. At home you can make chocolate puddings, but avoid chocolate cakes as much as possible. And if you are making your cakes, please make it with butter. Make your cakes with butter, at times with olive oil, if you know that your olive oil is coming from Spain. It's a cold pressed olive oil from Spain, you can have it, but don't think that olive oil which is highly processed and it is as less expensive as 500 rupees is a good olive oil. It is not. So a cake you can make it with sunflower oil, butter or a coconut oil. Alright. And you can enjoy sweets and mithais like coconut barfi, kaju barfi, pista barfi. Then at times your jalebi, gajar ka halwa. So these are the good sweets you can have. Children on a regular basis can have besan ka halwa, can have suji halwa. So also moong dal halwa. Make it seasonal and make it at home. Children can have it and they will not have any sugar craving. Then what else? Please, even when you buy cereals, breakfast cereals like chocos, ragi chocos, or cornflakes, avoid it as much as possible, or rather I would say don't have it. Alternatively, from a local vendor you can get freshly beaten corn and freshly beaten buckwheat or kodo millet flakes. You can use these, or ragi flakes, and you can add A2 cow milk to it You can add jaggery or you can add khand. You can have it, alright, without any fear. But what is important is the child should rinse the mouth after that. Okay, and says that probiotics should be included. Probiotics are very important. We know that there's a lot of advertisement also on it. But please do not get Yakult and do not get any capsules or any tablet form of probiotics. The best probiotic in winters is kanji, carrot kanji. You can make it at home or you can source it from the place who is making it properly without any additives. So this is a good probiotics. Then homemade dahi, buttermilk, fermented food like idli, dokla. These are good probiotics, very important for the gut, and you must include this in the children's diet. Apart from that, I can talk a bit about cooking vessels also. For boiling the milk, for your kid or for yourself, use clay vessel or use cast iron vessel. Do not use non-stick, do not use aluminium vessels. Okay, this will meet the requirement of multivitamin and multi-mineral. The child need not have multi-mineral because I also just checked yesterday that most of the multivitamins for children have xylitol, which is artificial sweetener, and sucrose. So avoid this unless the child has fallen sick and is on antibiotics, needs it for some time, but day-to-day basis avoid it. Start using healthy cooking medium and stop using hydrogenated oils, stop using vegetable oils like rice bran oil. Unfortunately, I was going through the list of so-called healthy packaged food. I don't know whether I should take the name or not, but it is every mother's favorite now to get the pancakes batter or the pancake powder mix. So if you see it has high vegetable oil, the children do not need vegetable oil. Children need good oils like desi ghee. They need oils like coconut oil or mustard oil, right, for cooking. They need nut and seed oils and desi ghee, not a vegetable oil. Rice bran oil and soya bean oil, these are the examples of vegetable oil. Right, so nut and seed oils, sesame oil, groundnut oil, coconut, then groundnut and peanut and yellow mustard. These are the oils which your children should have it, and desi ghee of course. So from here, I think I just conclude by saying that do not lead a life as a happy customer or a happy consumer. Live your life, be happy, and have belief in ancient Indian philosophy and techniques. Thank you so much for giving me an opportunity. I hope I have not bored you. I must have spoken like a grand old mother, old grandmother.
One thing I would like to add here, Nisha, is those people who actually brought up from the people like me who have own up children, because we raise our children that is spices and especially taste like the traditional food. So this is something which is our concept also. So it was more or less, on the same line.
Yeah.
Like, we also use their own sense to give them different kind of smell. But I would suggest some teachers here, like you said, that it should be done, very frequently. I would just tell all my teachers now to, just parents who are listening to you and should get the benefit of and try to make some effort. So whatever you suggested, actually they need effort.
They need efforts. They need efforts. Absolutely.
Packaged food, like you said,
Yeah.
it's easy for us to go buy and serve it.
Yeah.
Not to anybody
Yes.
at home.
Yeah.
But to do this, what you have suggested, it needs effort.
Yes.
But I would still say that no matter how much I think as mother, you should actually take out time for the children and do something about this because things are getting very complicated as far as the health is concerned. You know?
Yes.
And everything is interdependent.
Yes.
There's that, then it is related to the mental development.
Yes. Yes.
It is so interrelated and the facts were so surprising. Thank you so much for all this information which you have just shared.
Yes.
Right?
Yeah. These are experiences after becoming a parent to 4 children and my eldest daughter has played a major role because she has keen interest in cooking. So she is the one who brought me to the kitchen. And I started learning a lot by that and how to use khada masalas. मुझे कुछ नहीं पता था. You know, I never used garam masala. पिछले 2 साल से without adding the khada masala we don't cook. So these are the things which I have learned from her, and similarly the younger children. So we see that they on an average they're not asking for junk food, they don't have craving for the junk food, and so we travel a lot, that, and when we are traveling, we have to make choices because these things also again require a lot of attention to be paid to what to order, what to carry with us. So now when we went to the south trip, the beauty of the south India is that they serve fresh idlis, fresh vadas, even on the platform and in the train, right? But children of course do not eat sambar, so we carried a bottle of honey. So they like to have idli with honey. There was no problem. They like to have dosa with honey or jaggery. So we took jaggery also, and they have started having coconut water. So there is no asking for Tetra Pak juices. Obviously, right? So they are having coconut water easily. Although पूरा नहीं खत्म कर पाते, और also sugar cane juice. I was about to say this. Yeah. Yeah. Yes. Yeah. Yes. Yeah. 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 And then you eat and too much exercise of your jaw and your feet because you need to chew it. Yeah. To take out the juice from it. Right. So, but अगर मुझे लगता है आज के बच्चे जिनको हम इतना सब प्रोसेस फूड खिला रहे हैं, will they be able to actually eat Very again, hardly anybody is having sugar cane, but of late for my children I've started giving them sugar cane juice, which is again important. Fresh sugar cane juice. So hygiene का issue थोड़ा रहता है, but places like Modern Bazaar and Namash, they have sugar cane vendors. So one can have once in a while, one can have it, but one should introduce that taste. And the children should be able to choose what they want to eat when they're outside. Sometimes you're stuck outside, you have to eat the outside food. So better to go and have a kaju barfi or a rasmalai compared to picking up any chocolate or any ice cream. Other day I was seeing McDonald's ice cream. It is, if you see the ingredients, you will see कि भाई खाना कहाँ है. It is all having emulsifiers and उसका जो base है, that is harmful, right? It has milk, it has sugar. Milk and sugar is fine, but what about the carrageenan which it has? It is emulsifier. Now, when you read about the emulsifier and preservatives, FDA has approved it, right? So that is how it is present in our food. But how much of it can we consume in a day? Where is it written? We are brushing our teeth with toothpaste. We are then having a Tetra Pak milk. Then we are having a porridge. We are having breakfast cereal. Then we are having an ice cream from outside. Then some Tetra Pak juice or anything, or yogurt for that matter. In a day, how much of preservative have you already consumed? Is it safe? Is that limit safe? I was finding about lecithin, which is there in Nutella. So lecithin is from soya, it's written on it. And when you find about lecithin, it is like, it is okay only for 3 weeks. Beyond 3 weeks you cannot consume. Then how do we calculate how much of lecithin in a week have we consumed? So apps like Healthify Me, they will tell you how much carbohydrate we had, how much protein we had, vitamin we had. They are not calculating how much preservative we had, how much emulsifier we had that day.
Actually, as a layman, we also don't know.
Yes.
I'm sure the parents who are listening to you will get to know today that this when you're talking about preservation.
Yes.
What all does that mean actually?
Yeah.
Because we are eating, like you said, that it's written behind that box.
Yeah. Yeah.
But how much information do we have and how much we consume and all? I guess this is the kind of very good information which you have shared. So, if Nisha and Nina
I have a question.
Yes, parents, you can ask questions.
Okay, I just wanted to ask, like, when, if we want to give noodles to our child, for example, or if we are giving Cerelac to our child, can you suggest the noodles, like, there are some farm and all these brands also in the market. How good or how harmful are they for children? Plus, what about Cerelac? Because there is a very dual kind of a theory about Cerelac, good, bad, whatever. Because there are times that, like, I give it to my baby in a week, once in a week, and I also get to consume Cerelac, it's very yummy.
Yeah.
So, yeah, what is your take on that?
Yeah. It is yummy because it has sugar and it has additives, it has same flavor which is there in every pack right from the time we have been growing up, right? Because nostalgic feeling aa jati hai na, that in our childhood we used to have it. So they haven't changed it. So regarding Slurp Farm, I would say that it's good that they exist and we should use their products only when you are going on a vacation. When you don't know वहाँ पे खाना क्या मिलेगा और हमारा बच्चा खाएगा या नहीं खाएगा. But on day-to-day basis, one should not take it. Like even once in a week, one should not take it.
And then what is your take on breads for that matter? What about breads for children?
Ma'am, bread again, as I told you, source your bread from a local bakery who is not putting preservative and emulsifier. And try to get a sourdough bread because sourdough bread has healthy yeast and bacteria also. Whereas ultra processed breads like Harvest, Britannia, Country Delight, they have preservatives, they have emulsifiers, and they have hydrogenated vegetable oil. Whether it is they are adding oats to it, whether they are multigrain in nature, whatever it is. Ultra processed food should be avoided, and weekly once or twice sourdough products are fine, but try to get a good source. And उसको आप बटर में या देसी घी में टोस्ट करके या थोड़ा सा गरम करके दीजिए, प्लेन मत दीजिए, बिकॉज देसी घी में रोस्ट करने से क्या होता है that you are increasing the glycemic index of the food, plus it will be not that sticky to the teeth. जब हम हाइड्रोजनेटेड ऑयल यूज करते हैं या सफोला यूज करते हैं या फिर प्रोसेस्ड ऑयल यूज करते हैं या प्रोसेस्ड ऑलिव ऑयल क्यों ना यूज करते हैं, that will make carbohydrate rich food more sticky to the teeth and to the gut also. When you toast it in desi ghee or in these seed oils, वो teeth को ज़्यादा sticky नहीं होंगे. The digestion of it would start after stomach, not in the mouth. So today, most of the complaints we get it from children or adults is that जब मैं bread खा रहा था, मेरी filling टूट गई या मेरा दांत टूट गया. अब वो complaint नहीं आता कि मैं guava खा रहा था तो मेरे guava की seed से दांत टूट गया, वो एक चला गया. That I was hearing 10 years back. Last 10 years and more so now, it is like मैं तो बस मारी बिस्किट खा रहा था या मैं सिर्फ ब्रेड खा रही थी और मेरा फिलिंग टूट गया, मैं तो सॉफ्ट खा रहा था. ओके
Thank you so much.
Yes, yes, ma'am.
So this season we had a lot of cold and allergy and stuff. So is it okay to give chawal? My mom was getting saying, you need to give chawal.
Immunity. So allergies, ma'am, I will again I'll answer your question. But I will talk about gluten allergy. I will talk about lactose allergy. We are hearing it very common now. Every second person today has gluten allergy or lactose intolerance or some other problem. Again, it comes to the processing of the food. If you are consuming your wheat from processed आटा, जो पैकेट में प्रोसेस्ड आटा आता है, अगेन उसमें भी वो प्रिजर्वेटिव डालते हैं. जब हम फ्रेश चक्की से पिसवा के लेकर आते हैं, उसकी शेल्फ लाइफ सिर्फ 2 to 3 months होती है. In 2 to 3 months, after that we cannot use that आटा, वो spoil हो जाता है. So when we get freshly ground wheat and that wheat is thoroughly sun dried, it minimizes your gluten, and that is how in the olden days gluten allergy nahi hota tha, whereas today the babies, 6 months old babies, when we start giving them food, they are found they are gluten allergic, they are lactogen allergic. Lactose allergy भी A1 cow milk से आ रही है और processed formula feed से होता है. If we give A2 cow full fat milk, जितना processing of the milk होगा, skim milk, toned milk, means there is lot of processing of that milk has happened. Homogenization, जो tetra pack milk आते हैं, homogenized आते हैं, pasteurized आते हैं, ये सारी चीजें हमारी lactose intolerance को increase करता है. So when you get pure A2 cow raw milk and you boil it well at home, child will not develop lactose intolerance, and if you get your atta like this, the child will not develop gluten allergy. Now coming to Chyawanprash, you can give Chyawanprash, but nowadays you have people who are making Chyawanprash at home. So don't buy the branded Chyawanprash. Get it from a person who is making at home without adding the preservatives to it. The shelf life may be less, and that is good. You can give. There is no problem in that.
Yeah, this allergy I was talking about, the cold and the cough that is happening.
Yes, ma'am. It is very common now. There are multiple reasons for it. Again, it is if you reduce the chemical intake, your allergies will reduce. Your skin will get better. Your breathing will get better. You will not need air purifiers. And
Another thing I want to ask is, my son is not completely wean. We need to, I still breastfeed him for sleep. So do you think that, feeding at night, somewhere I read it's bad for the teeth or teeth cavities? Is that?
ma'am, it is. I told you it's very true. We are seeing number of cases high rise cavity, nursing bottle cavity, and in my experience, I have seen those with children who are formula fed bottle feeding at night, and the sugar was added to that.
No, I think they breastfeed.
Yeah. So breastfeeding, how old is your child?
Will be 3, but it
Okay.
still has that sleep associations.
Right, ma'am. See, you can continue, but try to wean him. Try to wean him now. Okay? You can do it during the day, but night weaning you must stop. It will be difficult initially for you and the baby. You need to comfort the baby in some other way. Okay?
I think only with me that's the family cooking.
Yeah.
So it's just something that.
Yeah. Ask your husband to make him sleep for a week. He will stop doing it.
But I just meant to ask from the perspective of dental hygiene.
Ma'am, you should stop as soon as you can. But if you are okay with it, continue for another few months. It's all right. But during the day, make sure that you are eliminating all the processed food.
Yeah.
Okay? Because cumulative effect should be minimum.
Yeah.
Okay?
I have a question.
Yes, ma'am.
How the food is related to the speech of the child? Is it related?
Yes.
How?
Ma'am, it is related because the dental development also will be affected. No, speech तो मैम tongue से आती है, lip से आती है, and the position of the tooth.
Correct.
Right, ma'am? If the position of the tooth itself changes, like for some children who are doing thumb sucking for a longer period of time, their upper two teeth come in the front. So speaking like F and B, वो different हो जाएगा. So children who are not eating, they are eating more of mashed food and pancakes and very soft food जिसमें ज़्यादा chewing नहीं करना पड़ता, so उनका teeth का position तो काफी lingual ही रह जाएगा ना. The tongue will also not get space to move around, and the lip also is drooped inside. So when we give the fruits, whole fruits and vegetable, and when crunchy fruits and vegetables are given, and child is chewing it properly, then there will be optimal growth, the tongue would get its space, the teeth will come forward, and speech will also become clear. Are you still there, Savita? And also, the malocclusion. The malocclusion is classified in 3 ways: class 1, class 2 and class 3. Class 2 is where the upper jaw is forward and the lower jaw is backward. So even for them, for children who has this kind of an occlusion, when they're trying to say something, they might not be able to speak clearly. Then class 3 is where the lower jaw is in front and the upper jaw is backward. So that generally happens in those children who have a lot of nasal congestion when they are growing up. Frequent bouts of cold, all the time the nose is congested. So maxilla is at the back and the mandible is forward. So and in that case the palate also is high shape. So because it is high shape, the tongue to touch the palate, a lot of effort has to be made. Sometimes it's so high that the tongue even can't touch it. So then the speech is affected. How to correct it is again by doing yoga, pranayama exercises, breathing exercises, and also by making the child speak in native language like Hindi. And third thing is the food. Environmental stimulation should be there. Ganna ko chilna, or biting into the raw carrot, cucumber, apple. So these things will help in settling the malocclusion. It is a long process because it. Yeah. Yes. Yes. Yeah. Yes. It affects them. It affects. Yes. So at home also stimulation has to be given.
So apart from these things, therapists also help the child.
But see, when it is a proven thing that there is a malocclusion, then the dentist has to treat. So we do a lot of orthopedic corrections. Especially during the growing period, we want to see the child so that we can correct the child orthopedically. We can expand the upper palate. That's called palatal expanders. So when it's a high arch palate, we put expansion and we expand the palate. Okay. So when it is class 2, then we stimulate the lower jaw to come in front and meet the upper teeth. So that is called class 2 correctors. Then if the child is doing thumb sucking and that's damaging orthopedic development, then we correct that habit. So then that is when we also again come into the picture. Yes.
Corrective therapy.
Corrective therapies, yeah.
So many things, based on your dental, everything is there which affects your growth.
Yeah. Yes. Yes, true. Thank you.
Anyone question? I guess we can stop here, Sami, and share this recording with the people who may not or might not be able to attend today's session. I'm sure with that
Thank you so much.
It was an eye-opener, this session. So informative session. Thank you so much.
Most welcome.
Our children were there.
Yes.
Yes.
Yes, absolutely, absolutely. I have grown as a parent, yeah. I could open my mind, I've been telling you my husband wanted to change me for last 15 years. And today I am where I have opened my mind to accept a lot of things, especially today is the time when I have started accepting ancient Indian philosophy better. And thanks to our Montessori house, I have learned a lot.
We should keep learning. That's how the life should be.
Yes. Really.
Thank you.
Thank you.
For joining in. Yeah. Okay. Thank you. Thank you, Nisha.
Welcome, ma'am. Okay. Thank you, ma'am.